So we're very pleased to have both Matt and George with us today discussing PRP, and looking forward to your presentation, guys.
Thank you so much for that introduction. Joe, it's certainly a pleasure to be here, and I want to thank yourself, Boston BioLife, as well as Apex Biologics for having me here. It's always a pleasure to be a part of a panel with such esteemed people such as Matt Murphy, which everyone says is like the smartest guy in the room every time you're in the room with him. A little bit about myself. I'm a physiatrist. I practice comprehensive pain management. I have a few different roles that I play, but primarily my biggest, largest, most interesting passion is with regenerative medicine, and I do practice some aesthetics as well, primarily down here in Southern California, Newport Beach area. And Matt Murphy, I think he can speak about himself, but he's obviously, like I said, typically the smartest guy in the room, and I'd definitely say he's the smartest guy in this chat.
I appreciate that, although I don't think my wife would ever agree with that if I'm in the same room with her. Yeah, I'm a scientist, a PhD doctor, not a medical doctor. I'm not going to be reporting on clinical advice per se, but strictly sticking to the basic science and biology of regenerative medicine and referencing some published clinical work. I'm a biomedical engineer by trade. I design devices and processes for isolating and purifying and concentrating a lot of these different regenerative elements that we can provide to patients. Thanks, George.
So here is a summary slide that talks about the important factors to consider when selecting the right PRP system. And one idea is just, is it flexible or is it predetermined? And that goes back to, obviously the clinician wants to be able to tailor the treatment for the indication. And is there flexibility in that PRP system or bone marrow system, if you will, or even adipose system to do that? Are you able to obtain enough blood such that you can actually obtain enough platelets or even IRAP or A2M to have a sufficient effective dose? Is the system easy to use? Is it fast? Is it consistent to utilize? And will it give you consistent and reliable results? And I think that's a big concern for people. And I think part of that is the PRP systems, and part of that I think people have to recognize is actually more patient dependent. It's a little bit outside of the scope of this talk. And the most important factor I honestly think for a lot of things is where it comes down for the patients. It's not just that they want to get better, they're also very price conscious. And you want a high quality system that provides good value compared to the competitors on the market. And so that is a big deal. I think it's important certainly to use products that are approved for medical use in this country or in the country that you're utilizing them for. And so that is an absolute must. You must be regulatorily compliant. So that being said, yes, I have evaluated at least 10 systems out there on the market. There are a few of them that I think are at the higher end of them. I currently use the XCELL PRP system. I like it for many of these reasons. I think it's very easy to use. I get reproducible results. I can actually tailor it for the different things that I do, not just treating orthopedic conditions, and not just being able to limit my leukocytes or include my leukocytes depending on whether or not I'm treating a tendon, a ligament, or a joint, but also how do I utilize it when I'm performing medical aesthetics procedures, and if I actually want to use a soft spin and have sort of a more enriched PPP, if you will, and utilizing that high volume because I don't want the red blood cells in there. I think that the XCELL PRP system is certainly qualifies or satisfies all these requirements. It is compliant, and as far as compared to many of the systems that I've seen and tested on the market, I think it is a fantastic use. and it has been designed by some very, very intelligent people some of them are my friends. I don't know if Matt, you have anything else that you'd like to add to this discussion, or any thoughts on this or what do you think makes a PRP system good? I certainly know that you've designed many scientific products, and especially in regards to regenerative medicine.
Well, it's hard to pick one thing, George. I think first and foremost, the clinician has to pick something they know is safe. And so on that discussion about closed versus open, and then there's a middle ground that most of these systems actually fall in, which is functionally closed. Technically, there's an opening where you load and unload blood and PRP, but for all intents and purposes, it's a closed system where it's not open air, like an old school test tube that's just got the top of it off. From an efficacy side, we want to be able to control what it is that we're preparing. Do we have the ability to get the platelet count in the range that is desired for whatever application is clinically? Do we have the ability to adjust the white blood cell content, yes or no? Do we have the ability to adjust the volume of the PRP? Because if we're doing a large joint, of course we want to use more volume. There's no reason not to draw in the extra benefits of more platelets and more of the regenerative proteins that are in platelet poor plasma. If we're doing a small volume application like a finger joint injection or a facet injection or a cervical disc, there's no use in preparing 10 cc's if we're not going to use more than 2. So having that flexibility is very important as well. Some positives about the XCELL system is it gives the user the ability to choose how much of the platelet poor plasma is collected with the Buffy coat. It also gives the user the ability to collect just the top fraction of the Buffy coat, which is platelets plus the non-inflammatory white blood cells, versus actually collecting the entire Buffy coat and even getting a little bit of the red to make a leukocyte-rich PRP. Its recovery percentage of both platelets and white blood cells is in line with some of the best in class for PRP in the U.S. market.
That's fantastic. That if Matt Murphy gives it endorsement, I certainly can appreciate that, and it helps me justify what I'm trying to do and accomplish in my practice. Well, I'd like to thank again Apex Biologics for their support